Every 40 seconds, someone in the U.S. has a stroke. Yet many don't realize it's one of the most preventable major health crises facing us today. Globally, about 1 in 4 adults over age 25 will suffer a stroke during their lifetime. According to WHO estimates, 15 million people suffer a stroke each year. Of these, 5 million die, and another 5 million remain permanently disabled. Did you know that up to 80% of strokes can be prevented through simple lifestyle changes? That's right. Small everyday habits can make a huge difference. Today, we're exploring the 7 most powerful habits that help protect your brain and heart from stroke. Each habit has its unique way of protecting your neurons, improving blood flow, or reducing inflammation. Before we dive in, let me ask you, where are you watching from? USA, UK, Canada, or Australia? And how old are you? Comment below because your age and lifestyle can shape how your recovery works. Stay tuned till the end, because I'll also share a powerful bonus tip that may surprise you. Whether you're watching from the USA, UK, Australia, or Canada, you're in the right place. We'll move step by step with warmth and clarity, and I'll support everything with the latest science and expert insight. By the end, there's a bonus tip you'll want to stick around for. It might just save someone's life. Let's dive in, shall we? Number 1. Lower blood pressure. High blood pressure remains the #1 modifiable risk factor for stroke, accounting for up to 50% of cases. Lowering just 10 millimeters of mercury systolic or 5 millimeters of mercury diastolic pressure can cut stroke risk by nearly 40%. The American Heart Association's 2025 guidelines emphasize earlier, personalized treatment, including a new tool, Prevent, which calculates your 10 and 30-year risk of heart disease and stroke based on blood pressure, cholesterol. Your goal, an ideal goal, is maintaining a blood pressure of less than 120/80, but there may be good reasons why you and your doctor will not want your readings to be this low. For some, a less aggressive goal, such as no higher than 140/90, may be more appropriate. How to achieve it? Reduce the salt in your diet to no more than 1,500 milligrams a day, about a half teaspoon. Avoid high cholesterol foods such as burgers, cheese, and ice cream. Eat 4 to 5 cups of fruits and vegetables every day, 1 serving of fish 2 to 3 times a week, and several daily servings of whole grains and low-fat dairy. Get more exercise, at least 30 minutes of activity a day, and more if possible. Quit smoking if you smoke. Track your blood pressure at home. Make it a morning ritual. Talk openly with your doctor about your Prevent score and whether earlier treatment makes sense for you. If needed, take blood pressure medicines. Act early, know your numbers, and take control, because prevention starts now. Number 2, lose weight. Carrying excess weight increases the odds of high blood pressure, diabetes, and stroke. Even a modest 5% reduction in body weight can start moving the needle on risk. Why it matters: obesity directly raises stroke probability, not only by raising blood pressure, but through inflammation, insulin resistance, and vascular stress. Losing just a few kilos can make a big difference. The updated 2025 recommendations reiterate that weight management is fundamental to preventing strokes, alongside diet, activity, and early intervention. Supporting frameworks like the AHA's Life's Essential 8 include healthy weight as one of 8 critical, measurable factors linked to better brain and heart health, and even cognitive benefits later in life. Real-life application. Set small, achievable goals. Aim to lose 5% of your weight this month. 1 meal swap or 10-minute walk at a time. Try to eat no more than 1,500 to 2,000 calories a day, depending on your activity level and your current BMI. Pair calorie control with movement you enjoy. Walking, gardening, dancing, whatever fits your lifestyle. Seek support. Community programs, online groups, or a trusted coach can make sustainable change more manageable. You don't need dramatic change, just a steady, human approach, and each pound lost is a win for your health. Number 3, exercise movement is medicine. Regular physical activity lowers blood pressure, improves circulation, balances weight, and strengthens your heart, all of which cut your risk of stroke. Research shows that just 30 minutes of moderate exercise 5 times a week can reduce stroke risk by up to 25%. Studies now emphasize that movement snacks, short bursts of activity throughout the day, are just as effective as long workouts for improving blood vessel health. For example, standing and stretching every 30 minutes reduces the risk of blood clot formation. Strength training and balance exercises are recommended alongside cardio. This helps not only stroke prevention, but also post-stroke recovery, reducing the risk of falls. A recent Lancet study revealed that sedentary time over 10 hours per day nearly doubles stroke risk, regardless of age. Real-life application: take brisk walks, morning or evening. If walking outside isn't possible, march in place at home. Try exercise snacks: 2 minutes of squats, climbing stairs, or light weights every hour. Find joy in movement. Swimming, dancing, cycling, or gardening count. If you don't have 30 consecutive minutes to exercise, break it up into 10 to 15-minute sessions a few times each day. Motion is life. Keep moving, and your heart and brain will thank you. Number 4, if you drink, do it in moderation. Alcohol is a double-edged sword. Heavy drinking raises blood pressure, damages blood vessels, and increases atrial fibrillation risk, all leading causes of stroke. However, small amounts, especially of red wine, have been linked in some studies to protective cardiovascular effects. The key is balance. What's new in 2025? The American Heart Association and World Stroke Organization now agree. There is no safe level of alcohol, but moderate consumption, up to 1 drink per day for women, 2 for men, is considered low risk. A global 2024 meta-analysis in the Lancet Public Health found that even light drinkers had a slightly increased risk compared to abstainers. But moderate drinkers who paired alcohol with a Mediterranean diet showed reduced inflammation and healthier cholesterol patterns. Alcohol-free alternatives are on the rise. Non-alcoholic wines and beers are proving popular among those reducing intake without giving up social rituals. Real-life application: if you drink, pace yourself, alternate with water, and avoid binge drinking. Choose smaller glasses and lower alcohol options. Try alcohol-free days every week to reset your body. If cutting back feels hard, seek support. Apps, therapy, or community groups can help. Alcohol is optional, not essential. If you choose it, keep it moderate and mindful. Number 5, treat atrial fibrillation, AFib. Atrial fibrillation is an irregular heartbeat that allows blood to pool and form clots. Those clots can travel to the brain and cause a stroke. People with AFib are 5 times more likely to suffer a stroke. A 2025 update in the American Heart Association guidelines highlights that AFib is often silent. That's why wearable devices, like smartwatches, are now playing a growing role in detecting irregular heart rhythms early. Recent trials confirm that direct oral anticoagulants, DOACs, such as apixaban or rivaroxaban, reduce stroke risk significantly, by about 60 to 70% compared to no treatment. Doctors also emphasize that treating sleep apnea can reduce AFib episodes, lowering stroke risk even further. Real-life application: if you feel palpitations, dizziness, or shortness of breath, don't ignore them. See your doctor. Use a smartwatch or home device to track heart rhythm, especially if you're over 50. Follow your doctor's advice on blood thinners. Skipping doses is risky. FIB doesn't always feel dramatic, but its consequences can be deadly. Detect it, treat it, and stay protected. Number 6, treat diabetes. Diabetes damages blood vessels and accelerates atherosclerosis, the buildup of fatty deposits in arteries. This dramatically raises the risk of both ischemic and hemorrhagic stroke. In fact, people with diabetes are about 1.5 times more likely to have a stroke compared to those without it. Experts now stress the importance of time and range for blood glucose, meaning how many hours per day your blood sugar stays between 70 to 180 milligrams per deciliter. More time in range equals lower vascular risk. Newer medications like GLP-1 receptor agonists, semaglutide, tirzepatide, not only control blood sugar, but also reduce cardiovascular events, including stroke. Continuous glucose monitors, CGMs, are now recommended more widely, even for some type 2 patients not on insulin, because they help spot dangerous spikes that contribute to vessel damage. Real-life application. Keep up with annual HbA1c checks, aiming for less than 7%, or what your doctor advises. Prioritize a diet rich in fiber, whole grains, and lean proteins while limiting refined sugars. Including physical activity, walking after meals helps control blood sugar peaks. Ask your healthcare team about modern therapies like GLP-1 medications if lifestyle and older drugs aren't enough. Diabetes doesn't just affect blood sugar, it affects your brain and blood vessels. Managing it carefully is stroke prevention at its core. Number 7, quit smoking. Smoking is one of the most destructive habits for your brain and heart. It doubles your risk of stroke, and the risk rises even higher if you combine it with other factors like high blood pressure or diabetes. Why? Cigarette smoke thickens blood, damages arteries, and lowers good cholesterol, HDL, making clots more likely. Even secondhand smoke is harmful. A large 2025 UK study found that people who quit smoking before age 50 cut their risk of stroke almost to the level of non-smokers within 5 years. Nicotine replacement therapies, patches, gums, lozenges, are still effective, but now combined strategies like NRT plus behavioral coaching plus prescription medications such as varenicline give the best quit rates. Vaping is not a safe alternative. Recent findings show that e-cigarettes still damage blood vessels and may increase clot risk, though slightly less than cigarettes. Real-life application. Set a quit date and tell your family and friends. Accountability helps. Replace the habit. Choose sugar-free gum, keep your hands busy, or go for a short walk when cravings hit. If you slip up, don't give up. Most successful quitters tried multiple times before succeeding. Every cigarette damages your blood vessels. Every day, smoke-free is a victory for your brain. Bonus tip: sleep well, live well. We often talk about diet, exercise, and medication, but sleep is the silent pillar of stroke prevention. The science. A 2024 review in Neurology confirmed that poor sleep, less than 6 hours or more than 9 hours per night, is linked to a 20% higher risk of stroke. Sleep apnea, in particular, doubles stroke risk by repeatedly lowering oxygen levels and raising blood pressure at night. The latest American Heart Association, Life's Essential 8, added healthy sleep as a core measure of heart and brain health. Practical steps. Aim for 7 to 9 hours of quality sleep. Keep a consistent sleep schedule, even on weekends. Create a calm sleep environment. Cool, dark, and screen-free for at least an hour before bed. If you snore loudly or feel exhausted during the day, get screened for sleep apnea. It's treatable and life-saving. Protecting your brain starts when your eyes are closed. Rest is not a luxury, it's medicine. Conclusion. Each step is simple, doable, and backed by science. Stroke prevention isn't about perfection, it's about progress. Call to action, CTR. If you found this helpful, please like this video, subscribe, and share it with someone you care about. It really encourages us and also signals to YouTube that our content is valuable. We create videos like this to help you live a healthier life. A lot of research went into making this video to ensure you get accurate and beneficial information. While we couldn't include every detail in the video, all the research sources are linked in the description below for those who want to explore further. And tell me in the comments, which of these 7 habits are you already working on and where are you watching from? The USA, UK, Australia, or Canada?